I was flying up and back to Chicago yesterday, and I heard your guest episode, which was great with Noah Lang.
Yeah.
I want access to that. I need to move to either Pennsylvania or Utah.
It's pretty cool, right?
But yeah, it's great.
Yeah. And just generally speaking, we should, as a company, check out Stride. I mean, I don't know exactly how we might make it work, but it is a beautiful UI. It is very, very easy to kind of quickly tell what's the right match for you personally with what's out there.
Yeah.
It's illuminating to see kind of what is out there, out there in the market. And look, I mean, I just think year over year, the price for us, small businesses like us going up 12% a year, it's like, it's just, it's going to get to a point where we're just going to say, contribution, please. Like, I'm tired, I'm tapping out.
Well, I mean, of course, I'm co-founder, involved at Jumpstart, but I do not use our benefits because I'm in an ACA plan, and it's better for Wendy does all of the decision making, and I get to agree or not agree. But she wanted a different set of doctors, different package.
That's the thing. It's not just premium. There's so much more embedded in the insurance decision,
and allowing the employee just to do whatever they want to do.
Yes.
With this contribution of money, and then I can take it with me when I leave. That's so much better.
So much better. So anyway, Noah, thanks for being on the show.
Yeah, so people should, if you haven't heard it yet, check out that episode.
All right, busy week. Let's go ahead and dig in. All right, so I actually was listening to the Bankless weekly roll-up before I came in here. So I've been under a rock all week. This has been a big sort of taking care of parents week and also doing important stuff for the fund. So I'm behind on the news. But right before we started this show, I got the news that inflation is higher.
From the crypto space.
Yeah, from the crypto space that inflation is running higher, that there's now questions around, rate cuts this year, generally speaking. And so it's not, which I think is not necessarily great because Powell has turned dovish and has been, trying to project that cuts are coming and that they are likely to make those cuts. But it sounds like inflation is going to make that a challenge.
Yeah. Inflation was higher than expected. 3.5%. And then if you take out food and energy, it was higher, which is kind of confusing to me, but whatever. Because oil is high right now, and for some reason food and energy was higher, 3.8. Doesn't matter. Higher than 2%. And I think the takeaway is that, in my mind, this is the soft, Powell used the word bumpy, soft or bumpy landing. Oil's high, and people are now buying stuff. Prices have come up a little bit. I don't think our steady state inflation is likely to get to 2.
Yeah, but 4. I mean, if it's dancing around 4,
close to 4 is not good.
That's not good, right?
Yeah, and so we will see. The market was really upset about it, and as you might expect, when CPI came out on Wednesday, the markets were down dramatically. Various Fed talking heads tried to come in and say, well, we'll look at everything. But then yesterday there was negative news out of China, which in this reverse weird world meant that the market was happy.
Yeah, right.
Because the negative news means you might get a rate cut.
Yeah.
Even though it's
potentially global leverage, arbitrage. It's complicated. It's complicated, but
it just demonstrates how reliant we are on this fake
narrative
thing of the Fed narrative cut being the most important thing. When a slight negative thing in China turned the market back. So it's that 2-day craziness has been now erased for the next day.
All right, and so that was sort of the headline. There is this story now in the Wall Street Journal that the headline says Fed rate cuts are now a matter of if, not just when. So more of the same, but I mean, I think this is emphasizing that we're not in the clear for a rate cut in 2024. Is that really the definitive feedback from the March print that, hey, we thought by March we would be at least more consistently dropping towards 2. And the fact that we're not, that it's higher than, that it feels like maybe it could touch 4 again, says, hey, Powell can't cut rates in an environment where it goes back to 4, right?
I believe it's impossible for the Fed to cut rates if we're trending up towards 4.
Yeah.
And then there's also an election this year.
Yeah.
And I also think the Fed's not going to want to do a rate cut like right close to the election.
Right.
So you really have June, and then I don't think they will cut in September because I believe it's too close.
Too close.
And then there's a meeting after the election in November. So you really have 2 meetings, and people have been hoping and praying and doing, rain dances to get 3 cuts. I don't, unless they did like a double where they went 50 basis points to 75, like they went on the way up, which I cannot imagine. There just aren't enough meetings. Now, maybe I'm wrong about the political thing. I just think they're not going to want to be like tagged by either side as trying to prop up one side or the other. So I think the article in the Journal is right. There's a question of, are we going to get 3 or 2 or 1 or none at all?
So just 2 minutes here. What are the implications of a flat year? I mean, I
don't know why we would cut. I mean, it's good for my venture portfolio, but
yeah, but even aside from that, like we have largely repriced things. Most of the crazy VC dollars right now are aping into AI deals. But outside of an AI deal, the deals that I'm seeing, a lot of discipline on the VC side in terms of, what the multiples are and strict adherence to revenue markers or things like that, right? So it feels to me like for a long-term
the VC space model has adjusted and seems priced appropriately now.
Yeah. So I guess I'm trying to figure out like what gets really hurt by a flat year. It feels to me like the real estate market has kind of adjusted better than I think most people thought they would. We still need to see if there's going to be larger fallout. It's funny, we just had a story locally that the Ritz-Carlton, that building, the site actually got sold in foreclosure.
Oh, really?
Yeah.
Interesting.
Yeah. We've been following that story since it started in 2020.
I know.
So like little stories like that are kind of popping up here and there, right? But like who?
But that's what we want. I mean, like that is the process, right? Like if real estate is overextended and not as many people are working in big office buildings as before,
Both of those things are true.
You would have some repricing. You'd have some debt things that didn't pay off for a bank, but it wouldn't like create the entire market. It would be worked out, and some would buy it out of foreclosure, and it would be okay. That's the way we want it to go, I think.
Yeah.
So I think the question is, what happens if the Fed doesn't cut? I think that's what you're asking.
Yeah, that's the question.
And my opinion is that we're in a what's called a K-shaped economy. I don't know if I love that term, but it just signifies that if you have, let's say, more than 30% of your net worth in financial assets on Wall Street, you're in okay shape, right? Like your house has gone up, your stock market portfolio has gone up, and you already have a lot of money anyway, so you're okay.
Yeah.
And it's the people that don't own a house,
right?
They don't have any stocks,
right.
They don't have a portfolio, their 401k has $20 in it.
Yep, all Zoomers basically. all Zoomers, and then people who are at certain socioeconomic levels. But like generationally, all the Zoomers are in that bucket.
Yeah. So they have done everything right? They went to college, they took on debt, they got their jobs, they're now paying their debt down, and they are losing ground. And so
and the dollar's being debased, right? And
inflation is going up. And even at 3% sounds, even 2%, let's say 2%. It still means that everything that you buy today is 2% more.
That's right.
It's not going down.
No.
And so that's the negative. It's a socioeconomic thing. It's like for the lower part of the K, they're already struggling. They're going to struggle more. I don't know how the Fed will navigate that, because if they cut rates, you're going to have inflation tick up and the stock market tick up. I don't know if it helps the bottom shape of the K that quickly.
Yeah. And
So they're kind of in this catch-22.
Yeah, and we're going to end the show as we always do with AI stuff, and AI doesn't help that either, right?
Yes, right.
I think AI accelerates the K.
It accelerates the net profit margins to large corporations that are largely.
So if you have capital, you're good.
If you own some of that,
right? If
you're good.
That's what I mean.
If you don't, all it means is like some of the value that the work is being done accrues now to not to the workers anymore, but to more the equity holders.
Okay, let's move on. That's depressing.
Your stock portfolio will be good.
No, but listen,
we're gonna have fires in the streets and people upset.
Exactly. Right. Yes, I've got a 25-year-old and a 23-year-old. Right. So that's who I'm looking out for. So we're circling back to this story about CMS and the Alzheimer's drug. I mean, we heard a lot about it during the 2020s. It was like the main story outside of COVID during that time. Haven't heard about it for a while, but Leqembi is the name of the product. And now we're getting a report that's saying the spending on that drug could hit $3.5 billion next year. So what happened here? Because I feel like this story dropped out of the headlines for 2 years. We just heard about the dissonance between FDA approving it and CMS actually being willing to pay for it. And now we're hearing $3.5 billion of spending on it by next year.
Yeah, I think we're going to have Emily in for our quarterly talk
next week.
Yeah, next week. So we need to talk to her about this. I think that. So this was the first time that I was aware that FDA approved a drug that CMS didn't want to pay for, didn't agree to pay for. And I believe there are different stages of the approval. And this is what we need Emily for, but I think there's like a tentative, that's not the right word, but like a pending further statistics, further evidence approval that the FDA has put in place to get people the medications as quickly as they can, where it's safe, but they haven't maybe done as much work as they'd like to do eventually.
On the effectiveness, I mean, safe is one mile marker, and then effective is an entirely different one.
Yeah, I want to be careful about saying something I'm not sure about, but the it got its full on. It's actually right on the screen right now. It got its full approval in July of this year.
No, 2023.
2023, yeah. Well, so last year.
Last year.
But this first came up like 2 years ago.
Yeah, that's right.
And so there are different shades of how the FDA approves, I think.
Yep.
And we can talk to Emily about that. But
yeah, we talked a lot about that during our digital therapeutics run.
Yeah, right. Exactly. Yeah. Exactly. And so I think it's in like the very complicated, multi-stage process of how FDA and CMS works. But this is an ongoing story in general without the details that I think we need to cover, and really all of our listeners need to cover. The FDA is no longer automatically. FDA approval does not grant you all CMS coverage, and the country is spending a ton of money on this and all the GLP-1 things, and there's a lot of money spent on these pharmaceuticals.
Yeah, but it is this like really crazy tight funnel where when you get to the end, I mean, if you can get through the gauntlet, the numbers are astronomical, right? I mean, to your point, FDA approval means a variety of different things. And this is why I think FDA consultants are so valuable, and why, just having the domain expertise before you actually start investing capital in this space is so important.
Right.
It's a reason why we're not heavy into the space in terms of like, our investment activities.
It's a very political, opaque space.
It's a hard space. But my goodness, like on the other side of it, the upside is unbelievable, right? I mean, because because really for two reasons. One, there's always going to be pent up demand and really, really large numbers of patients who are suffering with the different diseases that these new therapies can provide some relief or maybe even cure, right? So that's sort of the healthcare human reason to do it. The other side is it totally shifts capital, right? It disrupts. I mean, it's like what we were talking about with CKD and the idea that these GLP-1s could totally disrupt the dialysis industry,
Yeah.
And that's, we're talking about publicly traded companies, and moving all of that capital away from these facilities into these drugs that are, it's not just better quality of life, but so much more efficient to deliver the service from a healthcare service perspective. So
Well, that's true. I think it's also true that we need to have a discussion, and there's no one in DC that can have a discussion outside of sound bites. But what is CMS supposed to be covering and not covering? Right. So it is a drug that is safe. The FDA will assert that. It's effective. FDA can help with that. Maybe they will agree to that. Maybe they won't. But then there's a value discussion.
Yeah.
And I don't know that if there is a value equation or a process at CMS, I don't know what it is. But it's not clear to me how this should be viewed.
Let's save
so
that.
This is going to be a discussion for Emily.
I was going to say let's put a pin in that. Let's save that for next week with Emily, because my belief, and this is believing, that our government actually works better than most people think it does have those value discussions. It's just really opaque in the bowels of an agency that we don't have time to read through all the all the paperwork.
Yeah, so maybe Emily can help us with that. That's the reason I have no frame of reference that $3.5 billion is okay or not okay.
Yep. All right, next story in the MPJ, headline, Healthcare on the Brink, Navigating the Challenges of an Aging Society in the United States. So I'm living this. So why don't you tell me what this story is telling me that I don't already know?
Well, nothing.
Okay.
But Nature it might be the best scientific publication. It's one of the top 5 in the world for, I don't know, several hundred years. And so when Nature comes out with a story about how the U.S. healthcare system is not able to deliver the care for all of its people, even though there's nothing new as far as we all know the system is, very complex and overbuilt in some areas and doesn't have enough capacity in other areas. We know that, and we talk about it every week. Nature publishing a story about it, at least to me, got my attention.
Yeah, well, we can stop there, and let me kind of tell you what I've learned this year.
And this week. I mean, you've been learning this week.
Yeah. Let me tell you what I've learned this year. So when we're talking about aging, what's behind aging is a discussion about death. And death is not a topic most people want to talk about.
Right. It's
just not a popular topic. And so if you are not initiated in the club, you're not going to spend a lot of your time talking about it. I remember I remember kind of the first time that I ever heard the term silver tsunami, and it just sounds like this catchphrase, without fully appreciating what a tsunami feels like. This is not dissimilar to hearing about a tornado and never seeing the damage that a tornado does, right? I remember right before COVID hit, when the tornado ran through, North Nashville, Germantown, East Nashville, right? And I remember driving over there and being like, "Holy shit!" I had
the number of buildings.
Oh, and they're just wiped out, gone, right? But if you've never seen it, and if you've only ever seen it on TV,
TV does not have the scale to really help.
You don't understand. You don't understand what's actually going on. I would say this aging situation, this aging crisis, is very similar to that. And that's why the silver tsunami is actually a pretty good title for it, okay? Because if you've never experienced it or you're not in it, you don't know, you're not having conversations about it, and it's unevenly distributed, right? So, I happen to be the responsible child for my parents. Yeah. My 2 sisters are half sisters, so we share a dad, but we have different mothers. They are right now actively deep in the process of caring for their mother, right? So they can't just drop.
They don't have significant capacity.
No, they do not have significant capacity. They can't just drop everything they're doing to come down here. So it's largely resting on myself and my wife, who, by the way, is also
has her own family.
Yes, and is very, very deep in this process herself, right? What you realize once you actually get into it, and I'll just say I have to be one of the best connected people in Nashville in terms of healthcare, networks.
Connected and educated.
Yeah,
and,
I sit down on this podcast every week with you. We talk about it, right? Yeah. So I know a lot about it. And I've got people who are literally, great friends of mine who run assisted living facilities, hospice facilities, blah, blah, blah. So
where your dad is.
Yeah. I've got people that I can call to sort of ask all these questions. Every single day I am learning what the silver tsunami actually means, right? And what it means in terms of what aging people go through, right, as they are in the process of dying, which is a process that you don't have a timeline for, right? One of the best things that
it's not linear.
It's not linear. Yeah, one of the best things that my buddy Nick, our friend Nick Holland, said to me at the beginning of this process, because he had sort of lived it a little bit more than I had, was that this is not a project, right? And that was really
what did he mean by that?
Yeah. Okay. So let me explain. In a project, you can project manage it. You kind of control the inputs, and there's some variability, but like you set a deadline, you work, you think about the iron triangle, right? Your scope, your time, your resources, and you kind of manage your project along those different,
and you can have some level of control.
Yeah. That is not what is going on here. Okay. That is not what is going on. So let me give you an example of something that literally this morning I was talking to my wife, and she was talking to someone who had lived this and was like, oh yeah, like this thing. So my dad was discharged from skilled nursing facility. We had a great experience at the skilled nursing facility we were at. So he was discharged, and because of the nature of discharge, it's a really difficult thing, because at any moment it could not happen, right? And so because of that, let me finish.
The timing of it is hard.
Yeah. Well, let me finish. Because you cannot control or 100% predict that a discharge is going to happen, the people you would work with to get the home set up, so this would be home health, home care, PT, getting a follow-up appointment with your PCP, none of that will actually lock in until at a minimum you have a discharge date, but the discharge date only really signals when everyone else will come to see you, okay? And in between that time, there's something that people who have lived through it call the gap. And in that gap, you go from full 24/7.
You're in skilled nursing.
Very comprehensive
24/7 service.
And if you're in a good facility, I mean, it's great, right? Yeah. You're going from that to
nothing.
Nothing.
Well, you and Rachel.
Which is effectively nothing.
Yeah, right.
Okay. And
you're going through your own grieving processing thing. I mean, it's very complex. You should not be the service provider.
And the person, the aging person knows this, and they feel this, and like, and they are, somewhat helpless in this situation. So what's sort of a natural response to that? Anxiety. You think that's good for any of this?
No.
It's brutal.
Yeah. It's
absolutely brutal, right? But
it increases heart rate. It causes all kinds of issues.
Right? And you think about anxiety for young people, you think about anxiety for adults, completely different impact on an aging person who's already
has health
fragile
issues.
They're already pretty fragile.
Right.
But then, you get the people there from the discharge, and then maybe the person feels better, right? And so it's this roller coaster ride that you go on. You never could properly handle it all yourself. And then, did you actually take the whole day off? Did you properly give yourself the space to navigate it? Anyway, I'm taking up a lot of time here.
Well, let me just make sure I'm understanding. So the gap occurs because the skilled nursing facility says we're planning to, which is the key word.
Yes.
We're planning to discharge your dad at 10 o'clock on Wednesday.
Yes.
And they don't actually do that.
No. They try to do
that.
They do it. The problem is not that they don't do what they say they're going to do.
In my experience, it doesn't happen at 10. It's like it happens later. They need to get another thing. They need to do whatever. It worked perfectly for that.
Yeah, I've done 5 discharges.
So I'm glad I asked. So he left at 10.
Yeah, because I was there to pick him up. I've done 5 discharges so far this year. So I can tell you, I don't think any of them were delayed because of the facility.
Okay, so home health or other service providers won't show up at noon?
No.
So I don't even understand because I haven't been through it.
Yeah, you are thinking about this like a project.
Right.
This is my point. You're thinking about this like, oh,
yeah, it's so far, and I don't even know what question to ask.
No, everyone does what they're supposed to do.
Okay.
But with everyone doing what they're supposed to do, there is a natural built-in gap in that process, because when you get the person home, home health isn't coming that day. They're coming the next day.
Okay.
So that's
how they design it.
They will not come the same day. There is a 24-hour gap, because why would they schedule to come the same day if they don't know for sure that discharge is going to happen that day? They just don't know until it's happened. You see what I'm saying? They have to wait until it's all the way done, you're home, and then they can say, okay, discharge has happened. That's an actual event, an important event that triggers all sorts of stuff in health insurance and Medicare and blah, blah, blah. It's like, okay, done. Now we can move to the next phase, right?
Okay.
In that short gap, dude.
Yeah.
It's like, a black hole can swallow you in that 24 hours.
Even if I was thinking, I've struggled with discharge out of inpatient.
Yeah.
And there's a lot of people that have to sign off on it, and I think properly, but it creates a lot of complexity about exactly when.
Yeah.
But you're saying a different thing, which is you can't even really get people there until he's been discharged, and then they wait till the next day.
Yes, that's the protocol.
Yeah.
That's the protocol.
And that creates a 24-hour gap there.
Yes.
Which is
we have not even gotten into all of the resources that have already been poured into supporting my dad, through this process, and supporting us as a family. We haven't even talked about that, okay, which has been significant, and for which we're really grateful. Nor about what we will need in the future, which, because it's not a project, there's no predictability to it. It's a person's life. Okay.
Yeah. You have to figure it out as you go.
Yeah.
Yeah.
And back to the K-shape economy, dude.
You got paid on Wednesday, even though you weren't here working.
That's
and
what
not
I'm
everyone's
saying.
like that.
That's what I'm saying. So you compound all of this stuff together, man, and America has no idea what it is in for. Like, because my parents are older. They're not boomers.
Right.
My parents are in their mid-80s, okay? America has no idea what it is in for. You overlay all of these different trends, this AI thing, this Zoomers want to be influencers thing, just the inherent difficulty and challenge of this system.
Right.
Dude, we're in for it. We are in for it, and it's going to be hard, and it's going to be bad. And I'll just end where I started, which is one of the worst parts about it is it all really is about death. Okay. Which is not something people want to talk about.
Yeah,
and so until you are initiated in the experience, you will not get the guy. There's a reason why I'm talking about it on this podcast, because I want to try to make a practice of being more communicative about this, because I'm kind of shocked by how much I'm learning on a day-to-day basis that I just did not understand. And I'm 10 years deep in this industry,
I was in a board meeting yesterday, okay, of a company that I'm one of the larger investors in, that is a messaging tool for the post-acute space.
Yep.
So I'm supposed to know this stuff, and I didn't know about the 24-hour gap thing. It's hard to find
I
this
didn't
information.
know about it until yesterday.
Yeah, right.
And then this morning I'm talking to Rachel, and she goes, I was talking to a friend, and I was telling them everything we're experiencing, and that friend said, oh yeah, the gap.
Yeah.
And now I know what it is.
Yeah. And I've been thinking about how can you and I tell this to someone else who's at that skilled nursing facility today and could at least prepare themselves emotionally? Not that they could do that much, but they know this is coming.
There are things they could do. There are things that...
It's pretty hard to find the information, though.
No. I'm saying there are... I'm supporting what you're saying.
If we provided the information,
correct,
you could get ready. Yeah.
And as a broader thing, I will say, as great as these facilities are on caring for people, the discharge is abysmal. And I think it's because they don't get paid for it.
Yeah.
And I don't think that feedback or ratings around discharge is in any way, shape, or form material in their P&L, right? But dude, these are things they could do on a week before the day they come up with a discharge date. Okay, they could talk to you as the responsible person. Be like, okay, who's the responsible person?
Yeah.
All right, here's a shopping list. Here's a list of things you need to get if you can afford it. Here's a list of things you need to get into the house that will minimize the transition, that will make the person feel when they get home like they're moving into a facility that is somewhat similar to what they have here right now, right? Dude, they do not do that.
So you're running to CVS, Target, whatever, like that day to get stuff.
Totally.
Yeah.
Totally. Yeah, but based on things you experience when they get home because you're not with them. So
you're like, shit, I need this thing.
Yes.
Yeah.
Yes.
And then the other aspect is I think you could talk to your dad and say, there's this 24-hour period that's going to be a big transition. Like you could help with his anxiety if you knew ahead of time.
Yes.
But when you're in the middle of it and stressed about the thing you don't have, you're not in a position to do that very well.
No. So
anyway, Nature studied it, and they came up with the same thing you have uncovered, which is it's a challenge.
This is a massive issue, and
so this is important just because big health systems, big payers, the government will read Nature, and it's sort of like a credible source.
I think the thing I need to kind of understand, and then we got to move on. Obviously,
yeah.
I mean, because of everything that's going on, I actually don't have a lot of time for this podcast. But the thing I need to figure out, I need to start having some conversations, but I don't want to have them right now because I'm so emotionally lit up about it.
Right.
Is I want to understand better why the discharge process is so bad and so. And from my perspective, so thoughtless. 5 for 5. I've had no problem getting them out of there on time, but I feel, and I am someone who feels very capable. Somehow even through everything that's been going on here, I've managed to keep my workworkouts up. I'm here on time doing the podcast.
Yeah.
All the important meetings and stuff like that. I've been able to sort of manage all those things. I'm pretty goal oriented. I'm pretty project oriented. I'm pretty checklist oriented.
Yeah, I mean, I think that you had a pretty good thread to pull, which is no one's paid. There's no incentives to make it better.
It is. I guess what I would say is, if this happens as a wave throughout society for millions of people, the amount of mental and emotional anguish that is created, that's the part that's not really. No one is quantifying that piece. The amount of suffering you have to then undo and serve with therapy, with all these other things. It's crazy. It's crazy, man. So yeah, when I'm not so loaded up on this, I do need to start to have some more conversations to learn, because I am still in the learning process. I'm not going to run in there and try to ape and hero and fix this thing, but clearly there is a massive opportunity to improve this situation.
Yes.
Big time.
Yeah. I have lots of ideas, but let's keep going.
Yeah, thanks for letting me. All right, so are you fit for your age? This is actually a really good segue. Good job ordering this show. Yeah. All right, so Wall Street Journal in the health and wellness section has a headline: "Are you fit for your age? Test yourself with these exercises." So your cardiovascular fitness, strength, and balance can give you a read on how well you're aging. So Vic, what would they say here?
So they give you concrete things to test.
Yeah.
Right. VO2 max.
Yep.
That is hard to test on your own, but you can definitely get that test done, but keep going down. So other benchmarks are important. Like, can you do a 12-minute run? Okay. So can you run for 12 minutes or do 1 mile in walking?
Okay.
And that's a yes or no, right? Like you can.
Yeah.
Push-ups.
Yeah. So this is very, very binary.
Yeah. Well, but the push-ups is less binary. Keep going down.
Okay.
So they give you a range. What I liked about it is I'm between the 51 and 60.
Yep.
And so I need to be able to do over 30 push-ups.
Okay. To be considered excellent.
Be considered excellent.
Okay.
I think that is helpful.
Yeah, I mean, look, 30, that's not nothing.
Yeah, that's right.
30 is not nothing. I actually think that's a decent metric. And that's 30 at one time, right?
Yeah. 30, just
that's
like go sit down and lie down and do 30 right now.
That's not nothing. Okay.
Right.
Yeah.
So anyway, and then there's several of these, a plank.
Yeah. Okay.
So I thought it was a decent attempt at kind of a holistic, all the different aspects of health. Can you get to your feet without using your hands?
Yeah. Yeah. And this is actually a pass-fail test. Okay.
Yeah. And it's really, this is a technique that you have to learn.
Yeah.
Which is not hard to learn, but my wife taught me to do this. She just gets up because she's very fit and
probably has a lot of hip mobility.
Has a lot of hip mobility.
Yeah, hip mobility is key to being able to simply get up on your own.
Like, and I can't.
Yeah, so anyone's listening.
My Pilates teacher taught me this exact thing he's doing.
Yeah.
Which is not as exciting as Wendy's just stand up straight, but I don't have the hip mobility to do it. I can't. Now, maybe over time I'll get more flexible, but it's unlikely at 53. But I can still, what my Pilates instructor said is, you need to be able to sit with your grandkids at the Christmas tree and then stand up and go get coffee.
Yeah.
And if you can't, and you have to ask your 8-year-old grandson for a hand up, it's just not the experience you want.
Yep.
So anyway.
No, listen, I think that is, that's great. I love that this is in the Wall Street Journal. We need more of this. My little Aspen side project called Aspen Venture in the program. You need to do a venture.
Yeah.
is kind of around this. It's really centered around people 40 and older and older and their fitness and their athletic identity.
Yeah.
And it's super important because man, the two big things, the cardiovascular system and three big things: cardiovascular system, muscles, and mobility. Like those things are so critical for being able to stave off so much of what we just talked about, you know, and there is a point where if you're out of practice in those things, it just deteriorates.
Can't come back.
It gets really hard to come back. Yeah, it gets really hard to come back.
Just selfishly, I expect to die of a heart attack or stroke or something cardiovascular, or I will fall and break my hip and just go downhill.
Yeah.
Those are the two most likely ways given my family history.
Mm-hmm.
And so I need to try to do preventative things that help with that.
Yep. So, all right. Let's stop. Let Doug talk about Jumpstart Foundry, and then we'll jump back in for kind of a lightning round of stories because I got to go.
Thanks, guys, for the opportunity to talk about our pre-seed fund, Jumpstart Foundry. My name is Doug Edwards, CEO of Jumpstart Health Investors, the parent company of Jumpstart Foundry. We're so excited to be able to talk about early stage venture investing, certainly the need for us to change the crazy world of healthcare in the United States. We are spending 20% of our GDP, north of $4 trillion a year on healthcare with suboptimal outcomes. Jumpstart Foundry exists to help us find and identify and invest in innovative companies that are going to make a difference in healthcare in our country. Every year, Jumpstart Foundry invests a fund, raises a fund, and deploys that across 30, 40, 50 assets every year, allowing ease of access for our limited partners to invest to help us make something better in healthcare. Some of the benefits of Jumpstart Foundry is there's no management fees. We deploy all the capital that's raised every year in the fund. We find the best and brightest, typically around single-digit percentage of companies that apply for funding from Jumpstart, and we invest in the most incredible, robust, innovative solutions and founders in the United States. Over the last 9 years, Jumpstart Foundry has invested in nearly 200 early-stage, pre-seed stage companies in the country. Through those most innovative solutions that Jumpstart Foundry invests in, we also provide great returns and a great experience for our limited partners. We partner with AngelList to administer the fund, making that ease of access not only with low minimums, but the ease of investing in venture much better. We all know that healthcare is broken. Everyone deserves better. Come alongside us with Jumpstart Foundry, invest in making the future of healthcare better, and make something better in healthcare. Thank you, guys. Now back to the show.
All right, Vic. So Rock Health released a report on the Q1 2024 digital health funding. By the way, just thank you, Rock Health, for always coming up with these reports. It makes it easier for all of us in the industry who are, trying to make investments in the space. But anyway, basically, it sounds like Q1 of 2024, when we look at it against previous years, kind of a throwback to 2020. We've talked a lot about that.
Maybe go to the next one. We have a bigger image.
Yeah.
So, the funding by dollar amount per quarter and by number of deals, it's stopped fall. It's not a falling knife anymore. It's
right.
like it's stopped coming down dramatically.
Yeah.
I think we've sort of reached a steady state that we had before the pandemic, like 15, 16, 17, 18.
Yeah.
I think that's what this report says. Like we're sort of muddling along and it's not going down anymore. Yeah.
The average deal size is 20.6 million. That is below anything in the 2020s. 2020 was 30 million. 2021 was 39.6 million. 2022, 26.5 million. 2023, 21.6 million. So, not that far off of 2023, right? It's down, but not that far off. Yeah. And you and I talked about this. I feel that Q1 of 2023 was still a bit exuberant. The founders hadn't quite
deals
got the message.
Get done.
Deals were still sort of flowing. It really didn't feel like to me until Q2 where we really hit the winter. Even though there was a bunch of forecasting of the winter, it felt like Q2 of last year was really when the winter.
Yeah, we'll go to the
arrived.
next one because it shows it quarterly.
Yeah.
So on the left here, of course, there's a light green. 2024, we have Q1 data. And as we just talked about, it's lower, but it's not dramatically lower in deal count.
Yeah.
It feels okay. Q2, you can see what you were just saying that, in the green numbers and the blue numbers, is really Q2 and Q3 is when it really fell off, fell off. Everything fell off. So we'll see. I'm hopeful that Q2, it feels to me like we're going to be kind of bumping along kind of at a steady state now.
Yep. All right, and this story in Wall Street Journal Pro private equity section talking about a group called Santa Barbara Venture Partners that has basically taken to the secondary markets from a VC perspective. This is something that's been talked about. Carta was really trying to build out a secondary market. I think they've backtracked on that when they had that whole snafu where they were cold emailing people about selling their shares. But this one firm has, in the absence of IPOs, has decided to proactively sell their shares on the secondary market. And, it's generating returns where, for most VC funds, you may have markups, you may have markdowns, but you don't have a lot of liquid returns.
Right.
And so them liquidating on the secondary markets, whatever they're able to get for it is returning capital and probably does differentiate them in the market.
Yeah, and if you carry your assets at the proper value, I think by definition you should be able to sell them for some small liquidity discount in the marketplace. Mm-hmm. So the fact that they're able to do this, I think, means that they're carrying the assets in their illiquid portfolio pretty close to accurately.
Yeah.
And that gives the LPs confidence that they're getting some money back, and then they're not overinflating everything.
Right.
So I think it's a healthy step. I was happy to see it occurring. I think more of this would be good.
Yeah, I think it is interesting because the GP in the article was talking about how he was surprised that more VCs weren't doing it, and I sort of course, I'm a VC, so I thought, okay, well, why haven't I thought to do that? And I think initially, my response was, well, my LPs at this point in the fund, at no point did I tell them by, year 3.5, you were going to have liquid returns. So I think that's one thing. I don't feel like I've done anything that's against what we had originally projected we would be doing. I think the second thing is that I think we have done a good job of buying equity at the right prices or making sure that we have, recalibrated those prices to be, effectively sold in the future in this new corrected market, right? We're just not looking for unicorns. I mean, we're looking to build good businesses that can find good strategic homes. And so
it's a credibility thing. So you also haven't written up your book 10x.
Absolutely not. No.
And so if you had done all of those things, or you had invested in, a huge multiple, and then you are claiming that now the company's worth 3 times that. It's a credibility thing. So if you don't have any exits, people will look at your evaluations in your portfolio very carefully.
Right.
And it's either credible or not credible. Obviously, I'm biased. I think Nova is very credible. This firm in Santa Barbara, I think they did a bunch of B2C AI things that are highly priced now. And they wanted to prove that those high multiples are right. And the best way to do this is to sell it to somebody. You don't have to sell your whole. They didn't sell any entire positions. They just sold pieces.
Right.
It's kind of a hassle that doesn't actually generate return for your LPs, in my mind. So unless you have a credibility problem, I don't think there's any reason to do it. But if you do, it's very easy to then, okay, well, let's see what we can sell these things for.
Yeah.
So I don't think it would help. Your LPs wouldn't want you to do it because it's not going to create any value.
I'm not enticed to do this because I would feel like I'm leaving value on the table. That's not what I'm trying to do here. Yeah. Okay. All right. Continuing on. I don't think we can spend a whole lot of time on this, but yeah, I mean the Change Healthcare situation. Apparently, this is from darkreading.com. So I actually did not see this as a broadly aware story. These are people who I think are very, very dialed into what's happening in the cybersecurity world, and apparently a group called Ransom Hub speculated to have some connection to Alpha V, which was Alpha. I'm not sure exactly how they're pronounced. Stole 4 terabytes of sensitive data from the beleaguered healthcare company. So, I think to some degree, here's what I think is going on here. It's like once some of your data has been stolen, it's just going to be continued to be stolen over and over and over again. So, the dark web is full of everyone's data at this point. But, after Equifax, it was over, right? You know what I mean? It's like your data is kind of out there. And I think this is probably similar to that. The headline here says round 2, talking about a second ransomware attack. But I think once it's happened once, that's, you're kind of always going to be a target and your data is always going to be trafficked a little bit. This is just kind of the nature of what happens in these cyber attacks.
I think that's right. And I also think it is going to continue for Change Healthcare and United for a long time.
Yeah. Yeah. So, but look, everyone else needs to not get comfortable because I don't think
Apple, I don't know how many US when Apple notified a bunch of Apple phone users like proactively that their phone is being targeted. So I don't have an Apple phone, but my wife didn't get one, but that it's mostly, I think, international. But I've never seen Apple do a proactive thing. Like if you got a message, it means like your phone is being used and they've spotted whatever. So yeah, everyone is
crazy
seeing it more.
Crazy. All right. Wow. Bright Health. So, I mean, we were around for kind of the genesis of this company. We know co-founders of Bright Health, and I think it was an exciting time when we thought that health insurance may be in for a renaissance, and there may be some and look, there were some super credible people. Former UHG CEO, part of the founding team,
bring a new approach, much more patient focused approach to being an insurance provider.
Yeah, but the reality is that whole wave got sort of washed out, right? And so someone's trying to reboot Bright Health. Is that what's going on here?
Yeah, it's I mean, it went public and has lots of issues, lots of creditor problems, and they moved where they're located and changed their name, I think, to somehow give them a better chance to navigate this. Mostly I wanted to tell the audience that New Health is the old Bright Health. Yeah, right. That's the point of the discussion.
Got it. And spelled Neue. So New Health is Bright Health. Okay, we can keep moving. Here's a good story from Medscape. Are you ready for AI to be a better doctor than you? So I love it because it's actually got a scoreboard on this article.
Right.
This is basically the AlphaGo moment, isn't it?
I think it's the AlphaGo moment for clinicians. So
that's what I mean.
Yes,
that's what I mean for clinicians.
Yeah, where like all of Asia and AlphaGo players realized when Google beat the champion of AlphaGo, like, oh gosh, it's a new world. Medscape is a publication for doctors, and yes, it's written as 1, 2, 3, 4. They list 5, I think, different times when really reputable places like JAMA and other accreditation bodies judged how AI has done compared to practicing doctors. And it wasn't close. AI lost all of them.
No, AI won all of them.
Yeah, so sorry, I said that wrong. AI won all of them. Physicians didn't win any of them. And so they sort of start the article off with that AI is better than you, because most of the readers are clinicians.
Yeah.
And then they go to what I think is the real point, which is the takeaway that I've been sort of internalizing over the last year or so, is that AI is not going to replace every VC. VCs that use AI much more effectively than other VCs are going to replace the VCs that don't know how to use AI.
That's right.
It's a tool to amplify or augment what knowledge workers can already do.
That's right.
But you have to really learn it and know how to use it. And they have a whole second half of the article showing physicians how they can sort of internalize, use AI to get better, and a couple docs that are doing that, which is great. And hopefully it will wake up clinicians and they'll start paying attention more.
Look, not a surprise to us. We had Tarun Kapoor from Virtua Health on the show. He signaled this. He didn't say it quite in this way. He sort of more framed it around the future of new knowledge being developed in the healthcare field and how it's simply impossible for doctors to keep up with all the new knowledge as fast as it's being developed. And so over the long term, we're going to need AI to be this intermediary as a processing interface for all of the new doctors will need that as a tool. So that was, I thought that was a really good way to frame it.
Yeah.
This is, I think, a little bit more direct that, hey, you versus the AI, given, your command of the knowledge, the AI is going to outperform you in diagnosis straight up. Right. Okay. And yes, to your point, AI is going to beat the knowledge worker. Like that's what it just is. It's like,
it is. And that's not the competition that's going to happen. It's going to be a physician or a health system that is using AI to do much more, better, faster, have more time with the family, be more empathy, and then give
fix
them
the discharge.
many more fix discharge. That's who you're going to lose to, not a AI by itself.
Speaking of AI, Google Cloud Next was this week in Los Angeles. I was going to go, but I did not go. But it was as expected. A ton of big updates and announcements. I think the biggest one being that, look, everybody is focused on building their AI supercomputer. Google, is behind Microsoft in terms of their announcements and their buzz on this front. But that to me is an arbitrage opportunity because if you know Google, they're fundamentally super strong in cloud, and I don't mean Google Cloud versus Azure. I mean Google as a cloud business. Google was internet way before Microsoft was internet. Microsoft was desktop and install first. So yes, Google has
Google
created
and
their
Amazon are the cloud.
Exactly. The native cloud businesses. And so Google has built their own chip. They're building their own AI hypercomputer.
That was the surprising. I don't know why I shouldn't have been surprised. No. That was the surprising thing to me, that they're building their own chips.
Yeah. Well, that's not new though. I mean, the Tensor chip is they were doing Tensor chip before, right? And do you really want to be behind NVIDIA on this? I don't think you can afford to. You have to have your own hardware. You're like soup to nuts.
Yeah.
You have to be building your own computers if you're going to be in this game. And Google's been doing that.
Yeah.
This is not new. So they're building their own AI hypercomputer. They're continuing to bolster the AI capabilities in Google Workspace.
So
in terms
Sheets,
of Gemini,
Meet,
Sheets,
Docs,
that's right,
Gmail, all that stuff.
That's right.
Yeah.
And then also, like, if you want to be a coder, their Vertex AI is the interface that they're putting all this stuff underneath. So you'll have these APIs that will enable you to supercharge your applications if you're building them on Google Cloud.
Yeah, and I think they have a huge advantage with YouTube and Google Search. Microsoft bought GitHub, which was brilliant now in hindsight because they have a huge advantage in coding, but they're both competing in all markets.
Yeah.
So they have a coding tool.
Microsoft has LinkedIn.
Microsoft has LinkedIn.
That's right. People are really underestimating LinkedIn.
Yeah.
That is, I mean, you talk about the enterprise.
Yeah.
What an incredible data set that is, right? Ridiculous data set. All right. And then just wrapping up, sort of on the AI side, Google is partnering with Bayer on new AI products for radiologists. And, radiology has kind of always been considered the beachhead for AI just because of imagery, image recognition, diagnosis, all that kind of stuff that happens in radiology. A perfect place for AI to play a really meaningful role. And Google partnering with Bayer shows how the big AI players are going to partner with world-class healthcare companies.
Yeah, this is not surprising that radiology is a place to show what AI can do. It's just to sort of underline that the big tech players are going to find credible healthcare companies to partner with and go to market.
Yep.
So.
All right. We blazed through it.
Yes.
I got to move on to the next phase of the day, but thank you for putting together the show. And next week we'll be back with Emily Evans covering sort of Q1 and healthcare policy. We're going to do a deep dive on Medicare Advantage because a lot of stuff is going on in the Medicare Advantage space. And we'll also get some of our questions answered that we covered today, especially around CMS and versus
how
FDA,
we cover things.
how that all works. All right. Until next time.